And thank you for joining our presentation today. We are going to be reviewing Practice Analytics, the advanced module. Again, my name is Lori Bergen. I am a Senior Systems Optimization Analyst on the Health Solutions team, and I have been with Health Choice Network now for 10 years. Our presentation is slated for 2 hours, and we have a lot of good information to cover for you. So the learning objectives today. We're going to cover, high level of some of the things that were talked about in the basic presentation. So people that are very, very advanced in using Practice Analytics, this might be information that you already know. You might pick up a tip, but we have a wide variety of people on the call that have maybe just learned PA and they want to get more involved in the advanced information. So we're covering all aspects of people that are just starting to people that have been using this for a while. So your learning objectives is you'll know how to write a report using an existing report. You'll be able to create and use data lists. You'll be able to create and use multipath queries. That seems to be a 3-letter acronym that people don't often like, but it is a very, very cool tool within Practice Analytics. You're going to know how to do sorting and grouping and what the difference is between those two. You'll also learn what the and or functions are and how to use them, and how to use wildcards. And we'll also talk about the summary versus the detail when you're actually going through your report and what you have in that summary versus what the detail is. So on our agenda today, we'll talk about report building, data list, multipath queries, using and or functions, using the parentheses, wildcards, info writer, working with the summary sheets, crosstabs. There will be a quiz. We'll have a Q&A session. And then I wrote on the last bullet point, hands-on exercise. So I did something a little bit different. And I actually put in some exercises. So after you are done with this training, don't cheat now. You can go through the exercises and see if you can get the same output that we have in the answers within the hands-on exercises. So there's a couple really nice, cool reports that if you haven't built them in the past and you haven't used multipasses, these reports include at least one multipass or multi-multipasses. So it's a great hands-on exercise that you can do, as well as you can have your other staff that is using Practice Analytics try out. So the first thing I want to talk about is copying a report. If you are running a report that's in the public folders or the solutions folders, you can not change the refinements that are in that report. And when you go to run the report, you can't actually save the report. So if you put in on a date range that you want it for the last 3 months, you can put that in the refinement. But as soon as you go and you run the report, there's no way to save those refinements that you put in there. So you will have to continue to put those refinements in each time that you run that report. So it's always nice, if it's a report that you're going to use, copy that report. Find the report. There's different ways that you can copy a report. So once you find the report, whether it be in the solutions report or the public report, you can highlight the report. If you like carpal tunnel and you like your wrist to hurt all the time, you can scroll up to the top and you can drop down and find copy. If you don't like carpal tunnel and you want to make things easy, you can find the report and you can right-click on it. That will give you the same options as the action button. So once you do that, you copy that report. You can name the report the exact same thing. And then you want to actually put it in a private report folder. So you want to put it in your folders. Now, if you don't have any folders created and you just keep sticking reports wherever, the nice thing about folders is kind of like your Outlook. So you can put your financial reports in one folder. You can put your clinical reports in another folder. You can put your appointment stuff in another folder. So it's nice and neat. And if you want to go and find a report, you don't have to scroll through all of these reports if you just put them in one folder. So again, you can copy that report, bring it into your folder, and then you will have that opportunity to make modifications on it and save it. Building a report. So when you're building a report and you're in PA, you know that anytime that you want to build a report, that you have to go to write a report. Because if you already have a report created under your mine, if there's a report under the public folder, or there's a report under the solutions folder, you cannot take fields out of those reports. Those fields are going to be there until you go ahead and write a new report. We're going to talk about a couple different ways that you can write a new report. So once you're in write a new report, the most important thing is, what folder do I want to use? Now, people that have been using Practice Analytics kind of know where that information is being pulled from either Energy or EHR, and knows what folder they need to look in once they come into PA to pick the proper folder to run the report. So you want to make sure, is the charge detail really where I want to get all my information, or do I want appointment information? So knowing what's in these info folders is extremely important for knowing how to write a report, and or once we get into the multipath queries, what other folder can I select to write a report? Now, when you write a report, you can only use one folder. So you want to make sure that folder that you're in is giving you 99% of the information that you are looking for. When it's not giving you 100% of that information you're looking for, that's when we'll talk about using a multipath query, which will come down the road in this presentation. So once you get into building a report, you're going to find all these different things here. So if you like to click on just a specific folder within, let's say, the charge detail folder here, I can look at all of the details. I can say, no, I just want to look at the patient information first, pick those fields, and then maybe go into the charge information and pick those fields. But what I wanted to point out here, and we're going to talk about this as well in the presentation, is favorite fields. Favorite fields will be your friend if you have not ever created them before. When you create reports, most of the time, whether it's in appointments, it's in labs, you are using common fields in most of the reports that you're writing. So instead of having to go and look for them, I can mark them as a favorite, and then they're there for me. Right when I go to write the report, boom, I've already picked 15 fields that I can use without actually having to go search for those particular fields. So once you get in to the folder itself, you're going to find the fields that you want. So as you select the fields come over here. Now, these are the fields that are going to be in your report. If, again, I'm in a particular folder and I can't find what I'm looking for, sometimes you can come to all charges, to all the fields, and search. What's super important is the naming convention of the field name itself. What tricks people up the most is they think that a particular field in energy is called something, and it's not called that in PA. So if you look at the field name, it'll go along with what the expanded field name is and what folder it's in and what that actual field type is. So again, as you're going through, you can select all of your fields over here. Important information when you're writing a report. You cannot have more than 35 fields in a report. Okay, so if you have more than 35 fields, you're going to want to create 2 different reports. So once we've selected all of our fields, we get into our refinement screen. So these here, again, are the fields that you selected. Let me go back one screen because this is important as well. Over here, as you're selecting these fields, if you didn't write these fields down in the order that you actually wanted to see them, you're just grabbing fields and not putting them in any particular order, you can actually click on a field and move it up or down. If you clicked on a field and you don't want it in there, you can either double click on it and it'll go back over, or you can delete it. It will delete it from your field selection, but it will not delete it from the actual info folder. So as soon as you've done all of that, you're going to go ahead and you're going to click next, and we get to the actual building a report. So we have our fields here. You do have the option, again, to reorder your fields here, but you cannot remove any of your fields once you've selected them. You'd have to go back to write a report. And then here, we have our operator and our values. If you've been using PA for a while, you're very familiar with what these mean. So in the first column of your operator, you're going to have your equals to, is greater than, is less than, not equals to, is like, not like, etc. And then in your values field, you're going to have, I want everything. So on my patient person number, I want all of my patients. I can get a unique value. So if I'm actually on a particular field, so like a record status description, I can get a unique value and pick the actual value that I'm looking for instead of all. And then the data list, which we'll talk about, and then the multipath we'll talk about as well. So when you write a report and you have, let's say, 35 fields, you can scroll up and down, or you can click on this More button. And this More button will show you those other fields that you have beyond your scroll button. So I'm all about borrowing things. If I do not have to start from scratch, I'm not going to. There are a tremendous amount of reports that are already built, whether it be in public reports or in solution reports. So I'm going to go out there and I'm going to look first to see, hey, did Alex Dueso go out there and create a report already and it has 95% of the stuff that I want in it? Oh, yes, he did. I'm going to go out and I'm going to find that report. I'm going to run it. And if I like that report, I'm going to go ahead and I'm going to copy it into mine. Because once I copy it into mine, when I go to write a new report, I can click on this button over here. Select fields from another report. Now, did I have to copy it into mine? No. I could include all of the solution reports and all of the public reports. But you better have breakfast, coffee, a peanut butter, a jelly, and sandwich, and then maybe a snack in the afternoon, because it's with the amount of reports that are in public, it takes a while for this to load. If you copy the report into your mind, it is much faster to select it. So I would just go ahead and I'd say, this is the report I want, this breast cancer screening report. And then I would hit apply. Once I do that, super nice. Look, I did not have to go and write down all of those fields that somebody else used in their report for me to go and have to come into my info folder and select them again. One super important thing about this screen here that I wanted to tell you as well, when you copy that report, the most important thing that you want to do is look down in that description and find out what info folder that report was written from. Okay? Because if I pull in a report, or I try to pull in a report, let's say that was written in the appointment info folder, but I go into the charge info folder, I'm not going to see these reports because it doesn't match up with what I'm looking for. So be careful, look to see what info folder those reports were written in, because that is where you're going to pull that information moving forward. So as you see again, we've got all of our key fields. At this point, I can move them up and down. I can actually remove some. So let's say this report gave me 95% of what I wanted. Well, that 5%, I need to either remove information from the right and or add additional information that I'm looking for this report to generate information for me. So super nice, save yourself some time. A lot of times those reports that you're looking for are already written. Financial reports can get really tricky, but there are some really good financial reports out there as well. Copy them to your mind and borrow them. Much faster to get your report written than writing it from scratch. So we talked a little bit about the favorites, that favorite button that's in there. So whenever I'm in an info folder, I will see my favorites on the left-hand side. And then here in the middle, all of these ones that are starred, those are my favorite fields. If I'm actually looking for another field, let's say patient date of birth, I want that as a favorite within this info folder. So I would go and search for Pat date of birth. And then I just right click on it and add it to my favorite. Another way that you can do it as well is once you have all of those fields selected, super easy. I can just say, add all of these to my favorite, because I'm going to use these fields over and over and over again. Super important to know though, if you are creating favorites, they are by info folder. So if I'm in the appointment info folder and I've got all my nice favorites added, and then I go into the lab results favorites, I'm like, how come they're not there? Each info folder, you have to create the favorites. Data list. So what a data list is, it's really a collection of different values that you can use in your report. So simple explanation is, I have a clinic that has 60 providers. When I write my report, or when I'm using my report, I apologize, and I'm filling out the refinements, I can say all providers. I could use a range, but a range is only going to let me use 5 providers. But out of my 50 providers, I only run this report for 40 of them. So I'm going to create a data list. I'm going to create that once, and then I'm going to be able to use it over and over and over again. Same thing that goes with maybe diagnosis or procedure codes. Create your data list to use that. That way you can narrow down the results of your report. So we're going to talk about data list types and functions. So data list types, there's text, numeric, date. And data list functions are browse, import, modify, add values, edit values, and remove values. So our tip of the day for the data list types, if you're manually entering items in a data list, try to copy from a reliable source and paste the data list to avoid typos. So what that means is if I have an Excel document with all of my providers on it, I'm going to go and I'm going to highlight all those doctors on the Excel. I'm going to right click and I'm going to copy it, and then I'm going to import it from the clipboard. That way I'm not going to make any mistakes on typing a provider's name or procedure codes, mistyping a procedure code or a diagnosis code. Always better if you have an Excel document already created with this information on it, go ahead and copy it and import it from there. A lot of people get tripped up on text versus numeric. So text is alpha and alphanumeric. So for instance, in ICD-10 code, you have your alpha and you have your numeric code. So that is always going to go in as text. Your numeric only is going to be like your procedure codes. Some procedure codes do have an alpha code on them. So those would be text. But your straight procedure codes, 99213, 99214, 99215, etc., would be a numeric code. There are certain fields that must be created as numeric versus text. So text versus numeric. So when you're on a data list and you're actually looking at the field. So let's say I want to go and I want to import or browse, our diagnosis codes. Super important, look right here. It'll tell you that this field is actually a data type of text. Okay, another example is when you're writing a report. My diagnosis codes are a field type of text. So wherever you are in Practice Analytics, it is going to tell you what that field type is. If you right-clicked on a refinement within your report and you went to properties, it's going to tell you what your field type is there. Super important when you're creating your data list. So a data list gotcha. So when you're adding a data list, let's say if it's alphanumeric, I'm on this field right here, right? And this is a text field. The only thing that's going to show up in here in your data list are text fields. So if this was actually a different field and it was a numeric field, only data lists that were created using numeric would show up in your list. So how do I create a data list? Well, that's good to know. So when you're in Practice Analytics, if you go to Setup, Manage Data List, one way that you can create one is that you can actually click the Browse button. So when you click the Browse button, let's say I want to look at all provider IDs. So I picked my field, and then I come in, and it's going to list all of my providers for me. I don't need that Excel worksheet. Now I can click all of my providers, or I can hold the Control Shift or I can pick a few of my providers just by clicking here, or I can multi-select by holding down my Control and Shift key. Once you've done that, you'll go ahead and you'll select. You'll see the providers that you selected, and you'll go ahead and you'll save it. That's actually creating a data list by clicking on the Browse button. Selecting your field that you're looking for, whether it's diagnosis, it's procedure codes, it's provider IDs, it's service centers, then the information will appear. You'll highlight it, you'll select it, review it, and save it. Now, I can also bring in a data list from an Excel document. Super easy. So if I didn't want to go to the Browse button, I would go and I'd do Setup, Manage Data List, and then I would do Import. So once I click on that Import button, the first thing I want to do is actually go to the Excel document, highlight the information off of that Excel document that I want, and either right-click it and hit Copy or hit Control-C, which is also a copy. When you come into the import, you're going to do Copy from Clipboard, because that information that you just copied from that Excel file is on a clipboard. You'll see it down here on the bottom. You'll go ahead and you'll click Next, and then your names will appear in the data list that you just created from the import. So again, I can create them by importing a document. I can create them by browsing, but I can also create them manually. I can go in there and physically type in a numeric code, 99213, 99214, 99215. I can put in a range of codes. So you can do it manually as well. But if you're looking at a larger list, the best way is to either browse and add that information or import it from an Excel document. So we're going to go ahead and talk about multipath queries, everybody's favorite word. So what a multipath query is it takes information that you're looking for. So for instance, let's say I want to run a report for all of my patients that are coming in that's either had or had not had an A1C in the last 3 months. So we know right there, an A1C is going to come from the lab results folder. Appointment information is going to come from the appointments folder. So now I have 2 different folders I need to work from, which is going to be a multipath query. This is something that when people start using multipath queries, they get very confused. A multipath query is just that. It is querying results. It is not going to show you that A1C value in my appointment report. It's going to show me all the patients that are coming in that didn't have an A1C in the last 3 months. So super important 2 things. 1, when you're writing a multipath query, you have to have that access. So when you go in to write a report and you do not have the save or enter MP, which is multipath, you need to open a ticket with support so that they can give you multipath query. Okay? When you're writing your reports, this is the way I always look at it. What is the information I want to physically see in my report? Because that is my report. Do I want to see an A1C value? So I'll switch it up a little bit. Out of my patients that are coming in, tomorrow, how many of them have had an A1C greater than 9 in the last 3 months? Do I want to see that Bobby Test had an A1C of 11? Or do I just want to see Bobby Test's name on the report? That he's coming in and he has an A1C above 9. If I just want to see that Bobby does have an A1C above 9, and I'm going to give that to my MAs to say, listen, these are the people that we have to target for their appointments because their A1Cs are high. Then I'm going to write my appointment report and just get those patients' names. But if I want to physically see what that value was on that A1C in the last 3 months, I'm going to write my report out of the lab results. And then I'm going to create my Multipath query out of the appointment report. So then anybody that has an A1C above 9, I'm going to see Bobby Test and what his A1C level was. So always think, what information do I actually physically want to see? Because that is your report. Your Multipath is just going out, it's running your report first, and then it's going out and it's doing a query to say, find me this other information that I'm looking for. Super important when you're doing your Multipath. You can have one Multipath in a report. You can have multiple Multipasses in a report. But if you're new at Multipasses and you try Multipasses, please don't call me. Multipath queries can get very, very tricky. So we're going to go through creating one. And then I always say, when you create the Multipath, please do a quick view on it to ensure that you're even getting information out of it. So when you want to create a Multipath, you're going to go into that folder that you want your report to query more information. So I'm going to go back to the appointments in the A1C. So my Multipath is going to be on the lab results. So I'm going to go into the lab results info folder. I'm going to find the fields that I want. Now, I don't need all of those fields that are in my appointment report. I just need a very scaled down version of what I'm looking for. It's just going to go out and query the patient person number, look for an A1C if they've had one, look for the value if it was above a certain number, and only look for the last 3 months. So I'm going to put those fields here, very small. And then once I go to next and I get to my refinement window, this is that enter MP that I'm talking about. If you do not have that, then you do not have the rights, the Multipath rights within your profile. So once I put my refinements in here, so on my loin code, I only want to see A1Cs. I already know that that's 4548-4. On my result report date, in this particular instance, it's year to date. I can put the last 3 months. And then on this one, it's not showing me the value. It's actually telling me, show me anybody that had an A1C in the last year that the report was final. Again, you want to keep it super short and precise to what information that you want the system to go out and query on. Once I've put in my refinements, on a Multipath query, I always have to have a key field. Everybody's like, what's a key field? A key field is something that is in this Multipath query and is in my main report. Most of the times when I create multipath queries, I'm doing it on the patient person number. You have to be very careful when you actually put the key field in. Because if I went in and I'm like, oh, the key field's the LOINC code, but I go back to use this in my appointment report, LOINC code does not exist in the appointment info folder. Very important to know what's in your info folders so that when you do actually create or mark the key field, you already know that that is in your main report so that you can tie it back. Okay? And then once I save the multipath, I clicked enter the multipath first. I picked my key field. Now I'm going to save the multipath. When you save your multipath, you're going to put a name, a description. You could put it in public, but my rule of thumb is I never put anything in public until I absolutely know that that report runs and or if it's needed for my practice to use. If it's just for me, I'm going to keep it in private. In the folder, it's not going to allow you to pick a folder. Multipath queries always get saved in the multipath query folder. Okay? Once you've done all that, you'll go ahead and click OK. So now we did all that, and we're like, okay, where is it? Because now I want to attach it to my report. Now I got to find it. So in my reports, you're going to have a multipath query folder. This is going to give you all of the multipasses that you have created. Here's the one that we just created. Patients with year-to-date A1C results. If you saved it in public, you're going to have it under your Multipath Queries folder, and then there it is. So just remember, Multipath Queries are not saved in any other folder except Multipath Queries folder. Now the fun part is using the Multipath Query in a report. So now I've brought up my report that I want to use this in. Okay, so I filled out all of my refinements, what I'm actually looking for, and then on my person number, my patient person number, that's the field we clicked on that lab result. That is our key field. So this person number is the only place that I can get that multipath. I can click on the result report date and say get multipath, but guess what? You're not going to find the multipath because it's linked to the patient person number. So you go ahead, you'll drop that down, you'll say get multipath. So this is going to show patients who had an A1C result in the last year who had at least one non-voided charge encounter within the last month. So a little bit different. Now we're throwing some charges in there. So we wrote our main report on this one in charges. But our multipath query is still on our patient person number, and it is the one that says, show me the patients, or query the patients that have had a charge, non-voided charge within the last month that have actually had a final A1C result. And then as you see here, we're getting all charge detail. I don't see anything about A1C. But I know that these patients that are listed in this report are now only patients that have had at least one non-voided charge encounter in the last month and have had an A1C. These are the only patients that are showing up in this report. So now the cool thing is that I'm able to to query information from other folders and use it within my report. super important tip. Wherever you're writing the report is the data that you're going to see. The multipath query that you are creating, you are not going to see those values per se if you're doing a lab result within the report. It's just querying that information and then giving you what you need within the report. Once you start using multipath queries, you're going to think this is the best thing since sliced bread. And then you'll get into using the multipasses, which is super cool. But get your feet wet first and try the multipath before you start adding a bunch of them. So using the and or statements. So when you're writing a report, everything always says and, because I want the patient person number, and I want the patient's name sort, and I want the line code. Well, you can change these. If I click on this, I can actually change this to an or. So in this particular, so this one, this or right here was an and. So I clicked on it and I made it an or. So I'm saying I want the patient person number and the name and the line code. But when it gets to the ordered date and the result report date, I want the report to go out and look at the order date or the result date. So give me anybody that has had an A1C that was either ordered on the 5th or resulted on the 5th. And as you see here, these are the patients that had an A1C done that was ordered on the 5th, but it wasn't resulted on the 5th. It was resulted on the 6th. And this one here, I ordered it on the 1st, and I got the results back on the 5th. So the and or are really cool ways to change up the way that you're going to get information back. You can use this on many, many different fields. But just remember your ands, but your or is actually going to say, give me this or give me that. And is always the default when you go into your refinements. And the only time that it'll show up as or is if I actually click on it to change it to or. Now, if I clicked on it and I changed it to or and I don't want or, I made a mistake, it wasn't that refinement field I was looking at, you can click on it again and it'll change back to and. So using the parentheses. You're not actually putting the parentheses in yourself. When you actually change your and to an or, parentheses will go around that or statement. So you will never see parentheses around an and. If I go back one more, see how here we had our or statement, we have a parenthesis here and a parenthesis here. Now, if you're going to get creative and start using the or statements, I'm going to give you a little hint. If you click on one of those parentheses, it adds another one. And if you click on it again, it will add another one. And so what that's telling the system is it's almost like a repeat. But if you only need one parenthesis. So if you made a mistake and you clicked on it and you have another one, all you have to do is right-click on it, but you have to be right on it. And then you'll be able to remove the parentheses. It gets a little frustrating because when you try to right-click on it, you think you right-click on it and adds another one. So again, the only time that these are ever going to, the parentheses are ever going to show up is if you use an or statement. Refinement shortcuts. I really like shortcuts because it may not be a particular date range that I'm looking for. and it may not be a specific date function that I'm looking for. So if you're in this field right here, so my order date equals -1 month. Okay, and you'll notice that here it says -1 month. Down here, it's telling you, okay, this is what the date is today, but this is the date that I'm going to pull for you, 1 month ago. You have to be careful when you're using these shortcut refinements. I just gave you a couple of them, but if you actually go into the help menu in Practice Analytics, there is a lot of different shortcuts in there that you can use. I just didn't go through all of them. I just wanted to give you the top 3 that you may or may not use. But this is very nice to be able to tell the system exactly what you're looking for by using these shortcuts. Wildcards. It's another feature that I really like to use. So when you're using a wildcard, so patient name sort, let's say that one to begin with. I only want the patients in my practice that their name starts with LE. Whenever you're using a wildcard, you want to say is like, and then put your LE and star. So it's going to search for anybody's name that starts with LE because I put the star at the end. Now, let's say on patient name and I put the star in front. It's going to look for anybody's name that ends in LE. If I put the star in the front and the back, it's going to search for any LE that's in the middle of the name. Okay, so sometimes what I've done in the past is people with appointment reason codes. So I may have peds that have multiple, like peds new, peds established. So you can do a wildcard to look for those different types of appointments. Or if it's, I'm looking for the peds new, but I don't want the peds newborn, I can use a wildcard. I can also do it on a procedure code. So instead of going out and pulling in a data list, if I put the star at the end of my procedure code, it's going to go out and it's going to look for any procedure code that starts with 992. But remember, if you're going to use the star as a wildcard, this has to say is like. If you put equals in there and you put 992 star, you're not going to get anything out of your report. This is a field that is, or a function within PA that people don't commonly use. I like it because people like to see the report output in different ways. So I may be giving a financial report to my CFO who definitely wants an Excel report, wants some pivot tables and maybe some graphs. But I might be giving it a report to my nursing director that doesn't need all of that stuff on an Excel table. He or she just wants to see it in a report. So when you're actually writing a report and you fill out all of your refinements, when you hit the next button, you're going to get 2 options. You're going to get Info Writer or Workbook. 99.9% people use the Workbook, which then takes you to the summary and the details that you can manipulate things or you can just take all of that detailed information if you're good in Excel and pull it all into Excel and do what you need to do there. But if you have somebody that just physically needs a report, just like a generic report that you would run out of energy, when you write that report, or when you're running that report, should I say, once you've picked your refinements, click on the next and go to Info Writer. Super cool tool if you haven't used it. So once you get into Info Writer, the first screen that it puts you in is the report. So you need to select the layout that you want. Do I want it in details, or do I want it in summary? Do I want it in simple style, or vertical grouping, or simple grouping? So in this particular case, I just said that I want it in details and I want a very simple report. Once you click next, we get to the layout. Super easy. All I'm doing is dragging and dropping these fields over here. So maybe I didn't need all of the fields. I just wanted the report date, the patient's name, and what the actual lab code was. That's all the nurse wanted. I drag and drop those fields into the columns, and then I do next. Once I get to next, I get to the preview part. So within the preview, I can say, show it to me on the screen, print it, or save it to a file. I can save it to a file, and then I can actually just send it to the nurse via email. You can do portrait or landscape. These are just different things in here that you can play around with if this is something that you want to take a look at. And then the super cool thing is, this is what the output looks like. So you can put the name of the report. I just put Health Choice Network on the top. It's got the date that I ran it, and then it's going to have the page numbers on top. It's going to give you the patient names, the result date that those labs came in, and then the code. I could have done a more elaborate report, but I just wanted to show you what this actually looks like, and if it would benefit you, depending on who you're delivering, who your stakeholder is that you're delivering that report to. If they're not good with Excel and they just want the numbers, just give it to me, run it in an info folder, info writer. Summary details worksheet. So once you run a report, so you fill out all your refinements and you do next and you go to Workbook. We're going to talk about the summaries and the details within that workbook. They call the workbook worksheets. We'll talk about the toolbar overview, grouping, sorting, filters, and crosstabs. So when you go and fill out all your refinements, you hit next, you go to Workbook, you have two different sections. You have your summary information, which on the top. So from left to right, these icons are add a sheet, delete a sheet, rename a sheet, add a graph, which is another super cool thing. If you're running reports and the person you need to give the report to wants a graph, you can add a graph to the summary. A user-defined field, the percentage calculation, the sorting, ascending and descending, the sheet totals and subtotals. So if you're running a report and they don't want to have to count up all of that information, you can actually go ahead and put sheet totals or subtotals on there. The drill down, which is super cool. When you're on a certain field, you can actually drill down. If I ran a report on all 60 of my providers and wanted to see how many patients that they saw, I can go to Dr. Smith, right click and drill down on him to be able to see the exact patients that Dr. Smith saw. I can clear the filters and calculations. If you have not used clear filters and calculations before, I will guarantee you that you will hit the wrong one and you will clear out your whole entire summary page on the top. So just be careful when you're looking at it, what you're trying to clear. Are you trying to clear the filter or clear the calculation. Because if you do hit the wrong one, it will clear out your summary on the top. And then, of course, our little printer. And then this is a send to Excel. This one here is to insert more blank columns. And then these here are move the columns from the right to the left. So when you're in the summary, which again displays on the top, if you don't want to go to the icon itself, if I'm on a field, I can right click and I'm going to get all of that same information right here. My sheet, where it's going to allow me to delete a sheet or add a new sheet, my graph, my percentage, my drill down, clear, etc. So it's a preference from the user whether they want to use the icons or the right click option. Now the details worksheet toolbar is the information that when you generate your report and you click on Workbook, all of that information is going to come in the details pane, which is on the bottom part of the screen. So you'll notice that that one definitely has different toolbars. So it has the quick filter, the summary, crosstab, which is here, your calculations, which is your count and your total, and maybe a count distinct, your ascending and descending, your grouping of data, your send to Excel, and then move your columns from right to left. Now, these are the tools that you are going to use in order to get this data from the details worksheet into the summary worksheet. Again, some people are very, very good about manipulating data within PA itself. I am one of those people that use PA with the details and the summary to get my output instead of Excel. Some people are super good in Excel and can do amazing things with their reports. So all they do is they grab all of their detailed information that they want, pull it into Excel, and then do their pivot tables or whatever they want to do within Excel. Total user preference, whatever you wish to do. But again, if I'm actually on a field within the worksheet, I can right click and I'm going to get those same exact things, my calculations, my filters, my sort, group, etc. Grouping data. So grouping data, again, is either you right click and you find grouping data or you select your icon to group data. So what grouping data does is it collapses procedures for visit dates, for example. So if I came in and I saw the doctor and I had labs done, say I had 5 labs done, it's going to go in and it's going to take all of that data and group all 5 of those procedures into one procedure. So if you don't need to see every single thing that your patients had that day, you just want to know that they came in. I don't need to know that they had a 99213 and then 5 other labs. You can group data to be able to consolidate your report. So a visit report has multiple procedures you can group to get information at a visit level. So this is a report you can go and test this on. If you use the visits by provider and then group the procedure code, date of service, patient name and number, and credited staff. And on the procedure code itself, do a count. When you group data, it only shows up in the details portion of the screen. It does not show up in the summary, which is in the top. So when I select the field that I want to group, this top section is going to give me what I selected. Okay, so I pick the date of service, the patient name sort, the number, and the credited staff. But on the bottom, these are what functions you want performed. So out of all of this, for the date of service, the patient name, the patient number, and the credited staff, on their procedure codes, I just want to do a count. So if Lori came in and she had 6 things done, I just want to know that she was there and roll them all up and count it once, instead of showing me 6 different times as a line item. Now you can group data and export that to Excel. So again, this is the information that we said to use: data service, patient name, and then your count. So whatever function you want performed is where you're going to tell it down here at the bottom. I can say for the date of service, maybe I want it descending instead of ascending. Or my patient names, I want them descending instead of ascending. These will switch depending on what information that you're pulling in. And then, as I stated here, these are all one patient. So 1, 2, 3, 4, 5. Right? So it breaks it down. It said they had 1 evaluation and a management code, and they had 4 lab codes. So it's not going to show me 4 line items. If this person had 10 labs done, or it's a pediatric patient that had, multiple vaccines done, it will tell you within that procedure class how many they had, but just in 1 line item. Sorting data, pretty easy. I can either use the icon to sort, to sort up or down, ascending or descending, or I can actually right-click on the field, go to sort, and tell it whether to sort ascending or descending. Once I do that, as you see, here's my ascending on my date, and then here's my descending, which is going backwards. Quick filters. So the quick filter, when you actually are on a column and you go to filter and you do quick filter, that is putting the information here in this first column. Okay, so people commonly mistake the quick filter versus the summary. So depends on what if you say quick filter, that information is going to be put in this column. And then I can go to my next column and I can highlight another one, and then I can put that information here. But if I came over to appointment class and I right-clicked and I did filter and quick filter, guess what? It's going to take this information out and put this information there. So the other one that you can do is actually summary. Now, I don't know that many people that actually use the summary, but it is pretty cool. So if I'm actually on a field, so my appointment status description, and I go to filter and I go to summary, this window opens. So it's going to tell me the field that I'm on, but then down here, as I go through and I select that I want to see the date first, the appointment status second, and the reason description third, then this is what I see in my summary. That first column on the left-hand side. So I don't have to move all my columns and then highlight them all and then right-click and hit summary, or quick filter, I'm sorry. I can actually just go to the summary tab itself and tell the report, what do I want to show up, in what order do I want it to show up in the summary. Again, this is for people that are going to manipulate the reports within Practice Analytics itself and not exporting it, just exporting it to Excel. So crosstabs are another thing that are really cool to use. I'm not going to read this whole entire thing to you, but what a crosstab does is it will give you information vertically and horizontally. And it's going to grab a bunch of different information. So I'm going to show you real quick. And the couple notes that I want to tell you, or tips, is that you cannot group data and do a crosstab. You cannot do more than 4 fields in a crosstab. If you select more than 4 fields in a crosstab, you're going to get an error. And that error number is 3265. And the reason I know that is because when I first started using Practice Analytics, I got that a couple times until I figured out, oh, I'm using too many fields. So when you use a crosstab, there's certain calculations that you can use. You can use a count, you can use a sum, you can use an average, max value, minimum value, and then standard deviations. Important to know what you're looking for, because when I actually select what I want as a crosstab, I will go to filter and crosstab. And here is where we're on the appointment date. That's my refinement filter. So what do I want to see in row Y, which is the axis? Okay, so I said the appointment date. And then what do I want to see in column X? I want to see the reason description. And then what select field do I want to see, and what calculation do I want to perform? Excuse me. Once I figured all of this out, you always want to say to freeze your totals on the top line. Important when you're doing your crosstabs. Once I say okay, this is what it does. So I said I wanted to see the appointment date, then I wanted to see the reason, and then I wanted you to count the status for each one. This is kind of a strange report to do this on. This is, crosstabs are great to use in financial reports. So if you've never used a crosstab before, people that are running a lot of financial reports, I would highly recommend that you go in and try this on your financial reports. So when I'm in my summary on the top, remember my details are at the bottom, I can only create 5 summary tabs. In other words, I can only create 5 different reports from the detailed information. It will not allow you to do more than 5. Now, when I'm done either generating my report and I go to the workbook, I want to say I want to bring it out to Excel. Okay? Remember, you have summary information and detailed information. Did I do the stuff I needed to in the summary information? Yes. Great. Then you're going to click on the button to export the summary information to Excel. You want to make sure, one, you name it, but down here on the right-hand side, if you have more than one workbook, worksheet, you want to make sure that you export all of them. If you only have one main report, you can leave it just like that. But always remember to click all worksheets. Excuse me. And then go ahead and hit send. You'll notice if I do export to Excel on the detail information, I don't have those options of pulling in all worksheets, because I am grabbing all of this information down here at the bottom. I'm pulling it into Excel. I'm naming it. and then I'm going ahead and I'm going to send it. Excel's going to pop open. You're going to do all your manipulations, whatever you need to do within Excel. So I'm going to go over some tips and tricks, and then it's time for our quiz. So don't hang up, because the quiz is fun. So tips and tricks. So in PA reports, remember, you have a limit of 35 fields you can use in a report. Use encounter type description field when building report in clinical encounters. Info to capture tracking versus non-tracking encounters. Otherwise, it will capture all. Super important. So if you've been running it and you're not using encounter type description, go ahead and try to create another report and use that field and see the difference that you get. When performing calculations, it's a good idea to perform a distinct count on a unique field. Use record status description to not equal to void, and record type description equals charge when building a charge detail report. When copying a report, look at the properties to see if it is calling on a multipath. If it is calling on a multipath, you not only have to copy that report into yours, you have to copy the multipath, or it won't run. When I run a public report with a data list embedded, I get an error. And the reason is the data list is embedded in the report. You will need to have that data list. Either in your data list or the public data list. And now I'm going to attempt to do something. I'm going to first unmute everybody. I hope everybody's not asleep. Okay, so I'm going to unmute everybody. And now I'm going to go to the quiz. And now you don't have to say what it is, because what I'm going to do is I'm going to actually pull a poll, and you're going to answer the question on the poll. Okay? So what is the maximum number of fields a PA report can have? So if you'll go ahead and answer the poll. Hopefully you're seeing the poll.
No. The poll isn't up.
Ah, there you go. I'd have to hit launch. Sorry. I love it when people pay attention. That's super awesome. Okay. 35. Everybody is correct. Next question. What is the maximum number of columns that you can have in a quick filter? I'm going to go ahead and I'm going to launch that one. Okay, I get people switching their answers. Gotta like that though. So I'll go ahead and I'm going to close this one, and I'm going to give you the answer. 9. Sorry. Okay, next one. When using a wildcard, I can use the refinement that says equals all. So I'm going to go ahead. This is going to be a true or false. Okay, I think, whoops. Somebody's going back and forth. They've decided they're not going to answer it, but that's okay. So now if I close this, come on. It is false. Because remember, when you use the wildcard, you have to use is like. So what type of file do I need when I'm importing a data list? So I'll go ahead and I'll launch that one. We only have one more after this one. So what type of file do I need when importing a data list? Okay, about half the people actually answered it, so I'll go ahead and I'll close that. And it is a .txt file. So you want to make sure when you're importing your data list that that data list is actually a .txt file. When I copy a report, I do not need to copy any associated multipasses. I'm going to go ahead and launch it. Perfect. I think we got, so 70% got it right. When I copy a report, okay, now it's not coming up. I do not need to copy any associated multipass. That is false. I do need to copy the multipass. Okay, or your report won't run. So I'm going to go ahead and I'm going to do two things here at the same time. I'm going to see if anybody has any questions. I do want to, before I actually pull up the survey, at the end of this presentation is the hands-on worksheets that I actually have in here. Attempt to do it without actually looking at the answers, but the answers are in here because I didn't want you to get frustrated and think they actually didn't work. So I think there's 3 hands-on worksheets at the end of this presentation that you can go ahead and you can try. But I'm going to leave it open. If anybody has any questions, I'm also going to put up the survey for the rating for the training. If you could kindly fill that out before you leave the presentation, I'd appreciate it. And I'll open up the floor for any questions. Or did that just hurt everybody's brain with multipath queries? Or was it such a good training that you learned so much or you knew everything? I think somebody's actually writing one in a chat. I don't see the chat. You are unmuted, so if you do have any questions, please feel free to go ahead and ask those questions. Thank you, Mr. Dueso. Well, I hope everybody's super excited to go and use, hopefully if you are an expert at PA, you learned something that you had not been using in PA. And if you haven't been using it, then you can go and you can generate a multipath query and create the report, and it runs perfectly. Okay, well, if nobody has any questions, I'm going to leave the poll up for a few more minutes. And then I think when you actually leave the session, the poll comes up again. But thank you very much for joining our PA Advanced training today. Tomorrow, there is another training at the same time for PA dashboards. So if you're not familiar with the dashboards, please go ahead and register for that training. And I will be sending this presentation out either this evening or first thing tomorrow morning to everybody that attends. So thank you very much.